Hello, I'm going to speak to you today about SARS-CoV-2 variants and disease severity. This is a phylogenetic tree from the Next Strain website containing about 3,500 SARS-CoV-2 sequences obtained since the start of the pandemic, weighted towards the more recent viruses. In the first few months of the pandemic, the number of mutations per sequence was very low, and the mutations that were observed were mostly random. In late 2020 and early 2021, the number of mutations increased, and several in the spike protein were found to increase virus replication and interfere with humoral immunity. This prompted the development of a classification system in which virus lineages were classified, some virus lineages were classified as variants of concern and others as variants of interest. In the summer of 2021, the Delta variant became dominant, and it now accounts for nearly all circulating virus variants. This figure also shows that there is diversity characterized by multiple mutational differences, even within the same virus variant. The variants of concern and variants of interest have had two types of spike mutations: those that intrinsically increase virus replication and those that interfere with the humoral response to the virus. These two types of mutations work synergistically to increase transmission and disease severity. Higher virus levels increase the likelihood of transmission and are associated with more severe disease, while mutations that interfere with neutralizing antibodies increase the risk of reinfection and reduce vaccine protection. The mutations responsible for the variants of concern and variants of interest can be grouped into three categories. The mutations that intrinsically increase virus replication include the earliest emergent mutation in spike D614G, which increases the likelihood that one or more spike receptor binding domains will be in an open up configuration, leading to better ACE2 binding. Mutations at the S1, S2 cleavage site that increase S1, S2 cleavage, and the receptor binding domain mutation N501Y, which results in stronger ACE2 binding. A second category of mutations include those that interfere with antibody binding to the spike protein. Most of these mutations are in the spike receptor binding domain, while several are in the spike and terminal domain. Finally, several recent studies have reported that several mutations outside of spike can antagonize innate immunity by reducing interferon production and the response to interferon. Many of the spike mutations are shared by different variants of concern and variants of interest. Every variant of concern and variant of interest contains at least one receptor binding domain mutation at positions 452, 484, and/or 501, often with one or more receptor binding domain mutations at other positions that interfere with neutralizing antibody binding. Every variant of concern and variant of interest also contains one or more N-terminal domain mutation that interferes with neutralizing antibodies. The C-terminal part of the S1 attachment domain of the spike protein contains D614G and mutations at or close to the furin cleavage site, both of which increase replication. In the next three slides, I will summarize the mutations and characteristics of each of the four variants of concern: alpha, beta, gamma, and delta. The alpha variant was first identified in the UK in December 2020. It is about 50% more transmissible than the variants that preceded it. As I will show, it is also associated with higher virus levels and with increased disease severity compared with earlier variants. It has fewer immune escape mutations compared with other variants of concern, and it is therefore not associated with an increased risk of reinfection or vaccine failure. It has 12 mutations outside of the spike, and several are in viral genes that blunt the innate immune response by antagonizing interferon. The beta and gamma variants are not as transmissible as the alpha and delta variants. There are also fewer data on how these variants affect virus levels or disease severity. However, these variants contain additional immune escape mutations and have been associated with an increased risk of reinfection and vaccine failure. The Delta variant was identified as a variant of concern in the spring of 2021. Judging by its repertoire of spike mutations, it is difficult to determine why it has outcompeted all other viruses. Its success may reflect how its specific combination of spike mutations interact, or perhaps it is the 20 mutations that are found outside of the spike gene. The Delta variant is more than 50% more transmissible than Alpha, and it is associated with higher virus levels and disease severity. It is less likely than the Beta variant to escape the effect of neutralizing antibodies and to result in vaccine failure. Disease severity is usually assessed by measuring the risk of hospitalization and/or progression to more severe illness while controlling for other variables. However, because there are so many confounding variables associated with these endpoints, the most reliable studies have been those conducted in regions where 2 or more variants are co-circulating. In the next 5 slides, I'll summarize the most convincing of these studies. Of 8 studies that I've identified, 7 showed that the Alpha variant was associated with a 50% to 90% increased risk of death or hospitalization compared with earlier virus variants. 3 of these studies were from the UK, including 2 of the largest studies shown here that also demonstrated an increased mortality associated with the Alpha variant. In addition, 2 studies showed that virus levels were significantly higher in patients with Alpha variants compared with earlier virus variants. Although in the first study of ICU patients, the difference was confined to patients who were antibody positive at the time of presentation. In preparing for this presentation, I was surprised to learn that in the 2 studies comparing Beta and Alpha variants, the Beta variant was actually associated with a higher risk of hospitalization, ranging from about 20% to 100%. Although the numbers of patients in these studies were smaller than the numbers of patients in the preceding studies shown on the previous slide. There were also 2 studies that compared mortality in South Africa between the first and second waves that showed an approximately 30% increased mortality during the second wave, which was dominated by the Beta variant. But as I mentioned earlier, it is difficult to evaluate studies comparing non-contemporaneous populations. 4 studies have shown that the Delta variant is associated with a 30% to more than 50% increased risk of hospitalization compared with the Alpha variant. The 2 studies with the largest number of patients, which were from the UK and Ontario, are shown here. 2 additional studies, one from Qatar and another from Denmark, showed a 1.5 to 2-fold increased risk of hospitalization for patients with the Delta variant compared with the Alpha variant. A study in the US recently published in the MMWR showed no increased risk of progression to severe outcomes among hospitalized patients with the Delta variant compared to the Alpha variant. This study, however, did not assess whether there was a difference in the frequency of hospitalization among persons infected with these 2 variants. A much smaller but more detailed study from Singapore showed that the Delta variant, but not Alpha or Beta, was associated with a nearly five-fold risk of disease progression compared with patients hospitalized in early 2020. However, as I mentioned earlier, these were non-contemporaneous populations. The study also showed that the CT values were significantly lower, meaning the patients had higher virus loads than those of other contemporaneous variants, as well as variants isolated in 2020. And the plot is shown at the left. A preprint from China that has gained a lot of attention compared an epidemiologically investigated outbreak with the Delta variant to a similarly investigated outbreak that took place in early 2020. The mean virus levels at the time of diagnosis in the Delta variant outbreak were 1,000 times higher than the virus levels at similar time points in the earlier outbreak. In conclusion, SARS-CoV-2 variants of concern and variants of interest contain mutations associated with intrinsically increased virus replication, escape from humoral immunity, and likely antagonism of innate immunity. They are variably characterized by increased transmissibility, increased disease severity, and an increased risk of reinfection and vaccine failure compared with earlier virus variants. The Alpha variant is associated with higher virus levels and an increased risk of hospitalization and death compared with the variants that preceded it. The Delta variant is associated with an increased risk of hospitalization compared with the Alpha variant. Thank you for your attention.